Hello friends, welcome to Dr. Ossai Physiology Academy, Dopa for short. This is the place where we make the learning of physiology easy, exciting, and effective. Thank you for joining me. So today we are going to be doing this brand new topic, glomerular filtration. So we have talked about so many other things, structure of the kidney, renal blood flow, because of course filtration depends on what comes in as a renal blood flow. But as we said before, there are three basic renal processes: filtration, reabsorption, secretion. So now we want to now start focusing on each and every one of them so that we can now understand urine formation in its entirety. Okay, so we are starting with glomerular filtration. So in the lecture 3, we talked about renal blood flow. They are related. Some of the factors that influence renal blood flow, the way you measure them, the same methods, they are similar, but there are also certain differences. Okay, so I would like you to remember before we continue that learning about how this body, the various organs and systems of the body, how they function, can teach you a lot about your health, give you vital lessons about life, and even management lessons, right? So pay attention, let's get started. So glomerular filtration. Now this here, like you know, is the afferent arteriole, okay? While this is the efferent. This is the glomerulus or glomerular capillaries. Okay, so here is the Bowman's capsule. So this, after the efferent, it now turns into peritubular capillaries. This is just a schematic diagram. It's not the exact way it looks. Okay, but this is peritubular capillaries. Okay, then it now becomes the vein. Okay, so everything now leads to the renal vein. Okay, so this aspect of it is the peritubular capillaries, the arterial side, the venous side, leading to the renal vein. So what happens is that this is the tubule, okay? So reabsorption goes in here, secretion takes back into the tubule. So whatever is left after reabsorption and secretion is now excretion. So basically, excretion is filtration minus reabsorption plus secretion. That's that. We said that in the lecture 3. Okay? So now what we want to do, there are 2 things we want to discuss under glomerular filtration. One is the rate of filtration, because every organ in physiology, there are basic parameters we need to know about the performance. Because when you want to talk about the performance of anything, you quantify it. Just as, oh, you did well in an exam. How do you know? The scores, 70%, 70% distinction, 60% very good, and so on. You know, A, B, and all of that. So we quantify things. That's why we do measurements to know the performance. So how well the kidneys filter the blood is known as glomerular filtration rate. You understand? So it's the volume of filtrate per time. So it's related to renal blood flow, because renal blood flow is also measured per time, the volume per minute. Okay? So it's called GFR, glomerular filtration rate. So we're going to be first of all talking about the factors that determine how much is filtered, and then how do we even measure the glomerular filtration rate in the first place. So let's go right into it. Okay, so this unit here, the renal corpuscle, this is where everything happens about filtration. And in lecture 1, when we were talking about lecture 1B, we talked about edema and so on. We talked about that unit there, capillary exchange, the forces that play a role in what is filtered, what is reabsorbed, and so on. So the similar thing happens here. There are certain forces that play role at this junction. One of them is known as the hydrostatic pressure. The another one is known as oncotic pressure. So hydrostatic pressure is derived from the blood pressure. Hydrostatic, water, water makes up most of the plasma and all of that. So it's from the blood pressure. Then oncotic pressure, another name for oncotic pressure is colloid osmotic pressure. So it's the pressure that comes from the osmotic pressure or force of plasma proteins. So, and their directions, they are different, they are opposite. Now, hydrostatic pressure from blood pressure goes outward. That means it goes like this, down, inside this vessel. So that means hydrostatic pressure from here, it's always outward. So the hydrostatic pressure of these glomerular capillaries, you already know what it will do. It will favor filtration. Then the oncotic pressure of these glomerular capillaries, they are taking in, they favor reabsorption. Okay? Although reabsorption does not take place here, but generally they suck in fluid because of the concentration of plasma proteins. So get that into your mind. So that means it would favor reabsorption. That is the plasma proteins in the blood located in these glomerular capillaries. So these two are opposite. But then this is also a tubule, okay? Because the Bowman's capsule continues as the tubule. And fluid enters into it. So that means that filtrate is mainly water 90-something%, okay? So that it has its own pressure. You get me now? It has its own hydrostatic pressure. So what direction do you think? No, hydrostatic pressure, the direction is always outward. So the hydrostatic pressure of the Bowman's capsule goes outward. That means it's favoring reabsorption. That is opposing filtration. Then the oncotic pressure of Bowman's capsule is supposed to take in. That means it's supposed to favor filtration, but the Bowman's capsule does not have plasma proteins. Remember that filtration leaves behind blood cells and plasma proteins and some other very large. They cannot cross the filtration barrier. So the oncotic pressure of the Bowman's capsule is 0. So let us now quantify it so that we get more insight. Now we are going to group them into those that favor filtration, those factors that favor filtration, and the factors that oppose filtration. Okay? So favor. favoring filtration. Okay? Number one, glomerular capillary hydrostatic pressure. It favors filtration. Okay? So we just use this symbol, pressure, hydrostatic pressure. Glomerular capillary. It favors filtration. And that's the figure there is 60 millimeters of mercury. That's the hydrostatic pressure of the glomerular capillaries. It's higher than capillaries elsewhere because of what? The blood supply to the kidney is a direct branch, renal artery, direct branch from abdominal aorta. So it's high pressure. That's why it's like that. So the next thing that favors filtration, what do you think it should be? Filtration goes down here. That means it's supposed to be the oncotic pressure of the tubule or the Bowman's capsule. Okay? So oncotic pressure, we usually use this symbol, pi, okay, of the tubule. From here is the tubule. So it's supposed to favor filtration, but unfortunately it's 0. So that's that. So altogether, the force that favors filtration is 60. So let's now come here. Opposing filtration. The forces that oppose filtration. Let's look at it. Filtration goes down here. So what force oppose? That means the oncotic pressure of this glomerular capillary. Remember, it takes it in. That means it opposes filtration. Okay? So the oncotic pressure of the glomerular capillary is one of those forces that oppose filtration. And what is the value? It's usually 32 millimeters of mercury. Okay? Then another one that opposes filtration, what do you think it will be? Goes like this. So the next factor that opposes filtration is the hydrostatic pressure of this tubule. Remember, hydrostatic pressure of this tubule. Oncotic pressure takes in, the hydrostatic pressure of this tubule also pushes it. So hydrostatic pressure of the tubule, and it's about 18 millimeters of mercury. Okay, so look at the forces. 60 is favoring filtration, and this one added together gives you what? 50 opposing filtration. So altogether, you have 10 in favor of filtration. So if you want to group them, you come here like this and say glomerular filtration, okay, is equal to those that favor and those that oppose. It's equal to 60 minus 18 minus 32. Or you can just say this plus this, 60 minus 18 plus 32, because they are all together. All right? So gives us 10. So this is the filtration pressure, glomerular filtration pressure, the overall, the net filtration pressure at this glomerulus. So is that clear? All right? So the factors that favor filtration, fortunately, it's very high here, despite the fact that this one is 0. Then this one, 50. So we we are done with that. We have 10. So what we need to now know is that what are the determinants going from these forces? By the way, these forces here, they are named after a man who discovered them. They are called Stalin's forces. They are called Stalin forces. Okay, so when you hear Stalin forces, don't get confused. It's talking about this hydrostatic pressure, oncotic pressure that play a role in the overall filtration. Okay, so now the determinants of glomerular filtration. When we come here, this is what? Changes in the hydrostatic pressure of the glomerular capillaries will change glomerular filtration rate. Changes in this one, let's not mention it because it's zero, okay? Let's leave that. So there are 3 that we can really focus on here. So changes in the oncotic pressure of the glomerular capillaries will affect glomerular filtration rate. Then changes in the hydrostatic pressure of this tubule around the Bowman capsule area will affect it. So now you ask yourself, what can change the hydrostatic pressure here of the glomerular capillaries? Now, listen very carefully. It all starts from the flow, what enters here. If the flow here is reduced, the blood that comes in here, the hydrostatic pressure will be reduced. There's a slight difference between the things that increase glomerular filtration rate and renal blood flow, though they are related. And the difference is that renal blood flow takes into consideration everything, both the afferent and the efferent. But filtration stops here. It comes, so afferent supplies filtration and filtration stops here. Efferent, no. So anything that will increase the flow of the afferent will increase glomerular filtration. Why? Anything that will reduce the flow of this efferent, if it's smaller, it will still increase. So they are opposites. These 2 arterioles, they play opposite roles when it comes to glomerular filtration, how they affect it. Why? Because this one is smaller. It's not allowing blood to flow. So blood is now accumulating here. So accumulation of blood here increases hydrostatic pressure, which favors filtration. Okay? So but this one, because it's supplying this, if the blood flow is reduced, if it's constricted, it will reduce glomerular filtration rate. So you see that they play different roles. And that's why, lest I forget, in lecture 3, we mentioned angiotensin 2, that it constricts blood vessel, but more of the efferent. And because it constricts this efferent more, the overall effect will be that it favors glomerular filtration at normal levels. But when it's very high, it will just close everything. Okay? It will reduce. But at normal, mild levels, angiotensin 2 will favor filtration because it will constrict this one more than this one, just little. And all right, so that's just by the way. So these are the Stalin forces. So now, what do you think will increase or reduce hydrostatic pressure? Like we have said, sympathetic nervous system angiotensin 2, and those things that we mentioned, when they constrict this vessel, they will also reduce. When it's dilated, it increases. So that's that. So now, glomerular capillary oncotic pressure. What do you think can change it? Remember that it's caused by plasma proteins. Okay? So when there is little plasma protein, it opposes it. So the less the plasma proteins you have, the more it favors filtration. in cases like there's a disease known as nephrotic syndrome where you lose proteins. Because normally proteins are not supposed to be filtered. But then there's a problem. This place is now porous. So you lose a lot of proteins. So it favors filtration because there's nothing to oppose filtration as much as it should be. Then the next one is the hydrostatic pressure of the tubule or the Bowman's capsule. What do you think will? Similar to this one, once there's a blockage here, it increases the pressure here. The same thing, once there's anything that will block the flow of fluid in the tubule, it will accumulate and increase. And things that can cause that are blockage, like kidney stones that can block the ureter. You know, this thing continues and joins collecting ducts and becomes the ureter. So anything that will block the ureter, like kidney stones, will increase the hydrostatic pressure of this plate so high and to oppose filtration. So those that people that have kidney stones, it affects their urine formation. Their urine formation is reduced because it's increased. So you see how doctors think, how these things all play a role in determining how urine is formed. So that is all we've talked about, the determinants, okay? And one final one is proteins too can favor filtration. And it's related to that tubulo-glomerular feedback we mentioned in lecture 3 that relates to the factors that affect renal blood flow. Because proteins, they help absorption of sodium and chloride, which will now make this filtrate more dilute. And the macular densa will recognize it. And it will do what? It will dilate this. So it will favor more filtration. Okay? So those are the factors that easily change. The size of the capillary bed. You know, because all nephrons, they are not exactly the same size, just as human beings. You have human beings that are tall, huge, you have human beings that are small. So individual nephrons, about 1 million of them, they are not exactly the same size. But since we are referring to just one, an individual one, a smaller nephron that has a smaller capillary bed, call it a capillary bed, okay, will have less glomerular filtration rate than the one that has a larger capillary bed, okay? So the size of the capillary bed affects it. But that is nature, by nature. But what of the external thing that can change the size of this capillary bed? What do you think that would be? So these capillaries, glomerular capillaries, they don't have smooth muscles that can either make them larger or smaller, dilate, constrict, like these arterioles. So, but there are some cells that are close by. Remember when we were talking about juxtaglomerular apparatus, we talked about extraglomerular messenger cells. Okay? So those messenger cells, we said that are contractile, also known as pericyte. So because of their close relationship with these glomerular capillaries, when they contract, they can change the size of this capillary bed. Okay? So that's just that. But these are the main things that influence glomerular filtration rate. Those talent forces, I've mentioned them. So now let's go to how do you measure glomerular filtration? It is still based on the clearance principle, that concept of clearance. Just a brief recap. We talked about it in the previous lecture, lecture 3, during renal blood flow. So the concept of clearance is just talking about the fact that how much the amount of a substance that is removed from a given volume of plasma. That is clearance. The amount of a substance that is removed from a given volume of plasma per unit time. So that clearance concept is used in measuring renal blood flow and filtration because they are related. But there is a difference. And the only difference between the two, because when you use the clearance level, the clearance of the substance that you're introducing will be equal to what you want to get. If it's renal plasma flow, the clearance of that substance, and in the case of renal plasma flow, it's para-aminohippuric acid that fulfilled all the roles that when you get the clearance of that substance, it is equal to renal plasma flow. So now let's look closely at what is the substance that should be used to measure GFR, that's glomerular filtration rate. What are the properties? Now, filtration, we are dealing with only filtration. Just a recap also. In renal plasma flow, we said that that substance should be freely filtered. Quite all right. Then also, because we are collecting, we'll be measuring the concentration of urine that will come out from, that will be produced by the kidneys. Okay, and the flow rate of the urine. So that substance has to be freely filtered. But in the case of renal plasma flow, because we are measuring everything, we will still measure that substance is not, all of them is not filtered. Some 80% enters this efferent and goes like that. So to get the renal plasma, it needs to be secreted and it should not be reabsorbed. But in the case of glomerular filtration rate, we are only interested in what enters here. We are not interested in getting anything. So that substance must, number one, freely filtered. Number two, it should not be reabsorbed, because reabsorption will decrease it, okay? Then number three, it should not also be secreted. Secretion will add to it. So what you'll be getting will be more than the filtration. So it should not be secreted. So this is what differentiates the two of them, the renal plasma flow and glomerular filtration. The ideal substance, this is what, the other one should be secreted, but this one, it should not be secreted. So what substance fulfills this criteria? Substance is known as inulin. That one was PAH. This one is inulin. So it's just the substance that makes the difference. The procedure, everything is the same. Okay? So we'll not dwell too much on that. So GFR, glomerular filtration rate, will be equal to flow rate. This is the concentration of inulin. Okay? We put small inulin here over the plasma concentration of inulin. Because as you are taking this one, you're also taking the plasma concentration. So just revisit the previous lecture. There are other things we said that you need to listen to. All right? So this, when you extrapolate this, it will give you the clearance of inulin. And the clearance of inulin is equivalent to the glomerular filtration rate because of the unique properties of inulin. It's freely filtered, not reabsorbed, not secreted. So it measures only what is filtered. Okay? So this is how the clearance method helps us get GFR. And what is the GFR? When we do this, we'll find out that the GFR, normal GFR, glomerular filtration rate, is 125 milliliters per minute. So when you compare it with the renal plasma flow, which is 625, thereabout. So you find out that it's just about 20%. So the difference between them is known as the filtration fraction. Filtration. So filtration fraction, also known as FF, okay, is 125 divided by 625. That's GFR over RPF, which is 0.2. Okay? That's filtration fraction. So that is what you need to know about glomerular filtration rate, how it is measured. The same principles apply. So the only difference that gave us glomerular filtration renal plasma is just the substance. The other one used PAH, this one used inulin. So what lesson can we learn? The tools that you use can make all the difference in the results you get in life. The tools, that's what makes all the difference. You use a knife and use a saw, you'll get different results. So the tools that you use, so whenever you're not getting the results you need to get in life, one of the things that you should look at for, are you using the right tools? So these are the management life lessons we can learn from this. All right. So for further reading, you want to read after this, listening to this lecture, I've written a book in renal physiology. Everything I'm saying here, they're all there. So the link there, download the soft copy. The link is in the description box. You just go there, download it just for a token in Okada Books, and you get, just for further reading, get a better grasp of these things. All right? So see you in the next lecture.